Berks Community Health Center Presents on BCTV is supported by the Berks Community Health Center.
Hi, and welcome to Berks Community Health Center Presents. My name is Debbie Hartranft, and I'm the Chief Community Relations Officer at Berks Community Health Center. Thanks, and I'm glad you joined us today. So this is the time of giving, and whether you celebrate the holidays or not. And Berks Community Health Center is all about giving and caring and collaborating the whole year round. But we thought it would be good to highlight some of the things that Berks Community Health Center staff does throughout the year, but especially during the holidays, today in this broadcast. So with me today is Nicole Belote, who is the Social Determinants of Health Coordinator. We also refer to that as SDOH. And Danica Gabrielson, who is the SDOH Navigator and really manages our Food RX program. So welcome. Thank you so much for joining me today.
Hi, thanks for having us.
I think this is a great topic, especially this time of year, about giving back and having the wellness of the community in our minds and in our thoughts all the time. So what are some of the ways that Berks Community Health Center gives back to the community through the Social Determinants of Health program?
Yeah, so the Social Determinants of Health program, so for those of you who don't know, Social Determinants of Health are anything impacting a person's ability to receive quality health care. So that can be anything from housing, food insecurity, access to transportation. And so we at the health center, our team, we work very hard to figure out what's going on with our patients and work with them to try to overcome those obstacles. So just on a day-to-day basis, we're always hearing what's going on with our patients and how can we better serve them.
So when you say overcoming those obstacles, how are those obstacles affecting their health?
So for instance, if a person doesn't have transportation, they can't get to their medical appointments. So we may help them figure out what transportation options there are for them, whether that's using the BARDA bus or if their insurance offers them a different option, we work with them on that. Mm-hmm. If the person doesn't have access to quality health care or if they don't have access to quality healthy food, they're not going to be able to lower their A1Cs if they have diabetes, for example, because if you're not able to get that quality health care or that health food, they're not going to be able to get the health care that they need.
Okay, thank you.
Yeah, and realistically, I mean, if you're worried about having food on your table, are you really worried about going and getting your blood pressure checked or going and getting your blood sugar tested? You're more worried about getting the food on your table.
And for your children and your loved ones, yes. So tell me a little bit about what the SDOH team does if somebody does indicate they have a social determinant of health.
Yeah, so if we come across that somebody is in need of something, we'll meet with that patient one-on-one, either during the doctor's appointment or we'll call them after and see what's going on with them. We'll figure out if it's food that they need access to. We're gonna help them find Helping Harvest and get to some of the local food pantries. If they need transportation, we're gonna connect them right away with BARDA. We'll call their insurance companies directly and figure out what other options they may have. If it is housing, we're going to reach out to different housing companies and the different programs in the area and see what they might be qualifying for.
So how do you learn about a patient having a social determinant of their health?
So we do it a couple different ways. Our main way is we do what's called a prepare form. This is a nationwide survey that was developed to determine social determinants of health for patients. This form is emailed and texted to our patients 3 days before their appointments, and they can choose to do that online, or we'll go into the room and meet with them directly. But we also have amazing providers, nurses, and MAs who are all speaking with our patients on a daily basis, and they will often hear when talking with them what's going on, and then they'll come directly to us and tell us what's happening with the patient. They'll say, I just talked to this patient today. She told me she's on the verge of losing their housing. Can you please meet with them? Or this person didn't get their medication because they chose to buy food instead of their medication. Can you work with them and try to help them? So we'll often jump right into the room before the doctor or after the doctor and just see what we can do to help them.
And this prepare form that you were talking about, it's an assessment tool. What is it asking the patient
So I'd ask things like, we ask them if they have a safe place to live, if they need any help with getting resources like food, clothing, if they struggle with paying their utility bills. It also asks if they struggle with transportation, if they're feeling stressed, and if they need mental health resources. So it asks all of those things, and if they identify yes to having those insecurities, that's when we then go into the office or into their exam room and meet with them or call them.
Okay, and how many members are there on the SDOH team, and what do they each do?
So we currently have 3 members on the team. So we have myself, I oversee the program, and I'm constantly meeting with patients as well. And then we have Danica here, who I'll let her explain her role a little bit. And we have one more named Hennessy, who also meets with the patients on a daily basis and does the prepare forms with the patients and finds resources.
And Berks Community Health Center has 4 sites, so is this just offered at one of the sites, or where is it all offered?
No, each of us are stationed at one of the sites. Of course, Nicole did say there's only 3 of us. So at our smallest location at 2nd Street, I go there once a week.
Okay. All right, so tell us a little bit about your role.
So I am an SDOH Navigator, but in addition to that, I also do our Food RX program. So that is a new program that we have at Berks Community Health Center, and we are able to give free healthy food to patients who are diabetic, pre-diabetic, or screening for diabetes. So we get the food from Helping Harvest and some local grocery stores. We purchase and get fresh produce, as well as some healthy shelf-stable options. And then I work with the registered dietitian to come up with healthy food recipes.
Oh, wonderful.
Yeah.
So you're giving them options to try. Hopefully they like them. The recipes
Yeah.
hopefully get them interested in eating that food on a regular basis to help lower their A1C.
Yeah, and it introduces them to, new food items that they maybe didn't try before because they were afraid to spend their money on it and then not like it. But if they're getting it for free, they're more willing to try, and then they might find that they like something.
Give me an example of a food that you think they maybe didn't try before, but you're offering through this program.
So a big one was dragon fruit that we had in the summer. A lot of the patients said that they never had dragon fruit before, so we were able to introduce that, and then we had a few patients come back and say that they really enjoyed it. So that was
Awesome.
Interesting. Yeah.
I know when I went to one of the centers, I saw you had radishes.
Yeah, we did have
I
radishes
don't know how
too.
common that is, but
Yeah, so we had radishes, and then we also had a recipe to use with the radishes.
okay, wonderful. So have there been any patients that have really stood out to you that have benefited from the SDOH program at BCHC? Any stories you want to share about how this program is really having an impact for our patients?
Absolutely, I think we both have.
Go ahead.
No, you first, go ahead.
I had one patient who came to our center because she was living at Opportunity House, which is one of the homeless shelters, and she was pregnant, about 6 months pregnant, I believe, when I first met her, and she had nothing. She didn't have anything for baby, she didn't have anything where she was living, and so I worked with her a lot to try to get pack and play, car seats, baby clothes, diapers, bottles, and we just had an amazing support from our staff. I just sent out an email to all staff, and within hours my office was filled with items for these children, and a lot of them was donated from their own personal use, but a lot was actually bought. A couple of the providers and a couple of the other staff members just went out and bought supplies because they wanted to make sure that this new mother had everything she would need. While there, she also received quality health care from the OBGYN and our midwife to make sure that baby was healthy and that they were able to carry out that baby to a healthy pregnancy, to a healthy end. And she even told me she met with a chiropractor who has special background in dealing with pregnant women, and she was able to adjust her hip in such a way that she said giving birth was a lot easier this time than the previous birth because she had had that alignment, which I didn't know was a thing until she had mentioned it to me, but she said it was a lifesaver. Yeah.
I'm thinking they didn't have that back in my day.
No, not me neither. But now has a healthy 6-month-old baby. They're doing really well. She's still at Opportunity House, but I talk with her quite frequently still. She'll call me every few months and tell me baby is still going to Berks Community Health Center. She is established with Berks Community Health Center. She's only has positive things to say. Opportunity House has been working with her as well to try to get her housing and stable. And it's just, that's the one that always touches me because I just have worked with her for so long and we've been through a lot, so.
So you talked a little bit about Opportunity Health, also trying to help her. But I'm also aware there's some other organizations locally that help you with some of the items like the pack and play, I believe you get from Blankets of Hope.
Correct, yes.
And the car seats from AAA.
Yes.
So you collaborate with a lot of different organizations and our staff to try to meet the needs of the patients, and it's wonderful, and it's a great story. It really is. I'm glad you keep in touch with her, and I'm glad she's still coming to Berks Community Health Center for her health care as well.
Yeah.
That we can really kind of take her under our wing, so to speak. So do you have a story to share, Danica?
Oh yeah, I mean I have tons, but I mean going along with that story, I recently also just had to reach out for a mom who had a young child and she didn't have a car seat. So I also reached out and was able to get her a car seat and a pack and play. So yeah, that's just my most recent story.
Yeah, that's wonderful. Anything else that you want to share, stories or I know that sometimes there are patients with mental health concerns. Have you had any encounters with that and anything you'd like to share?
Yeah, I mean, when we're talking with patients, we're usually asking them a little bit more detailed about their lives and what's going on with them. So we'll often have patients express other concerns, mental health concerns, that they are in need of just somebody to talk to, and in the moment they may speak with us, but then we'll always connect them with mental health resources in the area. We do have quite an extensive list of those mental health resources and what insurances are accepted and which ones actually take patients who don't have insurance to work with them. And so those always stick out in our mind. We also have worked with patients to help with food stamp applications, LIHEAP applications. I had one woman, I worked with her and did a food stamp application, and a few months later did a LIHEAP application to help her get her.
What is
So LIHEAP is when it's a one-time grant that you can apply through the state each year to keep your heat turned on. So the state doesn't want to see anybody lose their heat during the cold winter months. So this is a one-time grant you can apply for so your heat doesn't get shut off. So it's a really great resource, and it's a pretty simple application, but if you don't know how to do it, or if it's in English and you're a Spanish only speaker, it can be difficult. So we work with our patients and actually will sit down and do that application for them.
And we're talking about giving back in the giving season. These are all services we provide for free. We do not get reimbursed for any of the services, so just really trying to keep them on the right path and as healthy as they can be in all regards. So are there any other enabling services that we at BCHC offer that you want to share?
So we also have the insurance enrollment team. So the outreach staff meet with patients one-on-one, and they try to find different insurance options, whether it be through Medicaid or if they have to do Penny. So I know they have a schedule and they meet with patients and help navigate the insurance process, because that can definitely be challenging.
Yeah, that can be a confusing process. We have community health workers as well, and I know that they reach out to patients who miss an appointment, or at least miss 2 appointments, find out, are there any barriers for them to come to their appointments? And I know recently one of them shared with me that he had a hard time getting to his appointments at 2nd Street, but he would have been easier for him to get to 838 Penn Street, so she helped him switch providers, and now he's able to attend his appointment. So all of those things that we're trying to work with the patients, identifying their needs and their barriers to try to lead healthy lives.
We also do help with transportation too. I know that we use our vans to sometimes help get patients if they can only, for example, if they can walk to Penn Street but they want to see a doctor over at Oak Brook. I know that we have staff that can provide transportation too.
Right, right. Back to insurance for a moment. Do you have to be a patient in order to have an insurance appointment to review your insurance options?
Nope.
Okay, and how do they make an appointment?
So they can call us directly. We do have a number for that, and it's 610-988-4838, and they're at extension 2960, and they do speak English and Spanish. So anyone who needs insurance, who's not sure if they even qualify for insurance, they can call that number and find out a little bit more information and hopefully schedule an appointment with one of our amazing outreach coordinators.
So you mentioned a little while ago about the OBGYN. I'm getting tongue-tied myself. Some of our specialty providers, obviously this isn't a free service, but let's just shed some light on some of those specialty providers that we have and why that's important.
Yeah, so we have quite a few specialty doctors, and I think it's worth noting because a lot of them were started because it's hard to find, for instance, a dentist that takes Medicare, or the Medicare plans may not do it. And while we do still charge, we have the sliding fee available for patients with all of our specialties. So we have the dentist, we have optometry too, which is a big one that a lot of people can't find an optometrist, and chiropractor, like I said, and our chiropractors are amazing, one of which, like I said, even specializes in prenatal care and child care. We have our OBGYN, we have a midwife, we have podiatry, we have the medical assisted treatment program, so those who are dealing with drug and alcohol can get the Vivitrol and Suboxone injections. We have our IBH staff to work one-on-one with folks with counseling. We have our registered dietitian that's available, 2 registered dietitians that are available to meet with clients and help them with healthier lifestyles. And we also have a blood pressure program where our nurse works with patients who might have high blood pressure and work with them on different programs to help lower that.
Yeah, and that's all amazing, and a number of different services you mentioned, but you also mentioned the sliding fee program. So Berks Community Health Center does not turn anybody away. They provide care to anyone regardless of their ability to pay, but we offer that sliding fee scale. Can you tell me a little bit about that?
Yeah, so I mean it's income based, and they pay a percentage of the bill based on their income.
Income and family size.
Right.
Right. Okay. All right, so let's talk a little bit more about other ways that our staff go above and beyond for our patients.
I think our staff is just amazing in that we all work at Berks Community Health Center because we want to give back to the community. I don't think there's any staff member in particular who's there just for the paycheck. I think we all really care about our patients and we really strive. And it shows every day. I had a patient one time who was dealing with mouth cancer, and not only was she given quality health care, but right away we all formed together, we all worked together, and we were able to come together, and I was working constantly with the nurse, the MA, the doctor, other nurses, just to make sure that the patient was getting to her specialty appointments, getting the transportation she needed, having food that she could actually eat because she was now on a special diet, doing all of those different things to work. And that's not something uncommon that we'll see. And I often have Drexel students, med students with me, and they are always shocked when the doctors are coming to me and I'm going to them and we're all working together, and it's not just one person's there to do their job. We are such a team. And like I said before, I asked an email for baby supplies and within hours had a room full. One time I asked for a stroller. Within 10 minutes I had 3 strollers given to me. Everybody just wants to give back and make sure that our patients have everything that they need.
It's definitely a mission-minded organization. That
Yes.
is very true.
Yeah.
Other ways? Do you want to share some, Danica, that you're aware of?
Yeah, I mean, especially like going off of the donations and being around the holiday season, 2 of our sites have a giving tree. So it's a little Christmas tree, and we put like teddy bears and hats and gloves, coloring books, and just like little toys for kiddos to come and grab. And that was all donated by staff, so they went out and bought things and just wanted to have something for people to come in and get. We were also had the opportunity to select angel tags if we wanted. So a lot of the staff members picked angel tags and went out and purchased gifts for kiddos who may not have otherwise gotten them.
Through the Salvation Army,
Yeah.
that program.
Yeah.
Yeah, that's awesome.
Yeah. So yeah, we're always getting things donated when we need to. We got some hygiene products donated to us that we're able to give out to the patients.
Yeah, I know that the United Way, again, collaborating with every other organization, the United Way contacted us about those hygiene products, and they had teddy bears from Godiva donated to them. They pay it forward to us. We provide it to our patients. It's just really a wonderful system that works for our community.
The staff are just all about giving back. I mean, we also have the Good Neighbor Fund where members of the staff were able to raise money for any of the patients who may be in need. Not something that is typically health related, but for example, I had a patient who his electricity was shut off at home and it was cold and him and his family couldn't stay there, and we were able to use the Good Neighbor Fund to purchase a hotel room for him for a few evenings.
It's wonderful.
Yeah.
Yeah. So how else does BCHC staff help the community?
Yeah, so we help it in, we try to help the community in a number of different ways. A lot of our staff is on board of directors. Our CEO is actually on 8 boards for local communities in the area. I don't either. But we are forming a team to walk for the coldest night of the year for the New Journey Community Outreach for their fundraiser. We have had staff walk in the Are You OK walk in the fall. We are always SDOH staff, my staff, or the outreach staff, we always try to sit on as many community meetings as we can, so we are learning about what's going on in the community, what's happening with local organizations, so that we can report back and tell all the staff when there's events happening or programs happening, so we can give back and help with our patients.
Yeah, we also have the community days that we do every summer. So we have a bunch of different organizations all come together at Oak Brook and Penn Street. And it's kind of like a little block party where people can come and get resources. And it's also fun. We have like raffles and games. And so that's always a fun way to give back too.
Wonderful. So what preventative services does BCHC offer for patients?
Well, I know that we do the preventative screenings at the appointments. So the MAs and the doctors will do things like checking their A1C. They also do pregnancy tests, diabetic foot checks, vision screenings. They can also do STD screenings, and then of course the flu and COVID testing and vaccines.
Yeah, and tell me a little bit about the Cancer Navigator that we have on staff now.
Yeah, so through a grant we were able to get the Cancer Navigator, and she is wonderful at helping patients get their preventative care. So she's helping schedule appointments so that they can get their mammograms or colonoscopies or whatever the patient may need to try to make sure that they're getting all of that preventative care and catching something before it's too late.
Right, I understand that sometimes patients will be referred to go get a mammogram, but time will pass. And often she looks for those gaps in those care and tries to educate and remind those patients how important that is. So that's really another wonderful service that we're providing, again, to keep people on track with all those screenings, everything they need to be aware of what's happening in their body and their overall wellness. We only have a few minutes left, so anything else you want to share that we missed?
I think just the other thing I'd like to shout out is just how amazing our staff is at helping other staff members. We've had many instances where staff members have been in need and they've stepped up and helped each other out. Last year, almost exactly a year ago, one of our staff members lost everything in a fire with her and her children. And our staff came together in such an incredible way where we were able to get her clothing, furniture, a new place to live, everything that she and her family needed. We really band together and got her those necessary items, and it is so amazing to see things like that. I've worked in a couple places before where we have cared about each other, but that was just
I know-
amazing. You don't see that everywhere.
Yeah, and I know you helped lead that effort a little bit, so thank you for what you did, the role you played in that whole thing.
Yeah, I also really love our like employee wellness fund, where the staff again donate money to do healthy and fun things for the staff to all do together. So we've had Zumba and salsa dancing. We also had like Reading Science Factory tickets. So I like that we're able to yoga.
Classes,
So I like that we're able to all get together and do new and healthy things.
Well, it definitely sounds like, and I know firsthand as well, but for our viewers, it sounds like BCHC really has the community's best interest at heart, very mission-minded. All the staff are behind that mission, and the examples you gave here today definitely display that. And I thank you for sharing that with us. So it is that time of year. If you can give time, talent, and treasure to whatever's important to you, I encourage you to do so. Pay it forward, be kind, and enjoy the season. And please join us again next month at Berks Community Health Center Presents.
Berks Community Health Center Presents on BCTV is supported by the Berks Community Health Center.